Our next speaker is Donny Suh, who is a professor and chief of pediatric ophthalmology in the Department of Ophthalmology at the University of California at Irvine. He completed his pediatric ophthalmology and strabismus fellowship at the Wilmer Eye Institute, Johns Hopkins University. He's an active volunteer faculty for Orbis. He's the chief editor for Medscape Online Reference since March 9, 2016, has over 100 published articles and chapters, and is currently involved in 20 institutional review board approved research projects. So Dr. Donny Suh is going to be talking on artificial intelligence and current studies on abusive head trauma. Dr. Donny. Dr. Donny, you'll have to unmute, please.
Sorry. Yeah. Can you hear me? Okay. Yeah. Can you see my slides? Okay.
No, your slides are not visible, although your screen is.
Oh, okay. Just a second. I apologize.
Yes.
Apologize.
You'll have to reshare. I think you've stopped share.
I apologize for the technical.
Dr. Suh, go on your talk, double click. Go on your presentation. Yeah, and now make it slideshow.
Is this okay?
Yes, perfect.
Perfect. Thank you very much.
But you are
no, you're on viewer screen. You're not on full screen at the moment.
No, and he's on his last slide, I think.
Oh, nice.
Yeah.
Yes, now go to slide.
Yeah. Now just go to full screen.
Full screen. Okay.
Yeah. Oh.
No.
So in the display settings,
sir, can you share your screen, not your presentation, sir? Please share your screen.
Donny, in the display settings, after you go to the presentation mode, if you hit that, just on the top it says display settings. If you can click that, next to the show taskbar, there's display settings and end slideshow. Do you see that on the top?
Oh, here?
Go to display setting.
Yes.
Okay.
And it should be swap presenter view to slideshow.
Yeah.
Yeah. Great.
Is this okay?
Yeah. Great. Go ahead.
Okay, sorry, I apologize. Okay. Well, thank you very much. I'm truly honored to be giving a talk at this prestigious meeting. I realized that this is actually one of the oldest ophthalmology societies since 1930, so it's about 27,000 members. So I'm truly honored. First, I would like to thank my co-investigators. Without their help, this would not be possible. So for next about 9 minutes, I'll try to make it quick. I would like to talk about the current research. So when we have a child that is not doing well for various medical reasons, with the retinal findings that look like this, we have to go through extensive differential diagnosis before we come up with a final diagnosis. And in terms of, there aren't too many conditions that can result in a 3-layer retinal hemorrhages with the preretinal, intraretinal, and subretinal in multifocal areas simultaneously. So they're only you could actually think about normal vaginal delivery, induced retinal hemorrhages, or retinal microaneurysms, Turson syndrome, and of course, finally, you have to think about trauma, including abusive head cases. But the dilemma is that, as we have alluded to, normal vaginal delivery can result in significant retinal hemorrhages in up to 50% of the babies. And when you look at some of these pictures, they actually look somewhat similar to the abusive head trauma cases. And also, accidental traumas with here's a retinal findings in a kid that actually had a soccer ball injury. So these retinal hemorrhages can be in one areas, but also it can be in multifocal areas. So how do you make an accurate diagnosis? Because as we all know, false negatives can be very dangerous to the child because you'll be putting the child in danger. False positives can also be just as detrimental to a family, and as a matter of fact, it can destroy the dynamics, as you can imagine. So finding the truth is important. So we as ophthalmologists play a very, very important role in helping to find the truth. In the quest for finding the truth, one of the biggest questions that I have been asked as an expert witness is how much force is needed or generated during various traumas resulting in retinal injuries. So we created a computer simulation model, something that's similar to like this, and also along with the retina that actually has broken down into subretinal, intraretinal, and preretinal. And so we created about 300,000 different individual points, and we analyzed each individual points by simulating the shaking of this computer simulation model, similar to the dummy doll model experiment. So we shake this simulation in a finite element, and we created these stress values in different parts of the retina in 300,000 different points. And what we found was that the pre-retinal, intraretinal, and subretinal layers actually had pretty similar forces, and that was statistically not significantly different. Then we went to the soccer ball injury, and we created a similar type of injury where we collided the eyeball with the soccer ball, and we actually measured the force that the retina experiences. And as you can see, something that's very interesting is that as the force propagates posteriorly, it creates this vacuum, if you will. It's a negative pressure. So that there's an initial impact with a compressive force, and then as that force moves anteriorly, it creates almost like a vacuum, resulting in tractional force. And we were able to document and follow that force using a graph form. And as you can see, there's an initial impact, and then it gradually decreases, unlike the shaken baby syndrome model. And also, in a normal vaginal delivery, we actually created a similar type of model, where as the baby transverses through this small canal, we wanted to see exactly what force is exerted on various parts of the retina. And so here, I'm going to show you. Here, as the eyeball, along with the head, transverses through that small canal, vaginal canal, and you can see the different forces that you can actually see in different parts of the retina in a live fashion. And you can see the small peak initially, and then there's a bigger peak as the baby's head is going through the vaginal canal and with the second peak. So when you look at these, graphs, they actually have a very different patterns depending on the different types of forces that's exerted on the retina. And this probably explains the different types of retinal hemorrhage patterns in different models. And as you can see, just a quick, something that we should note is that here in the vaginal delivered babies, the greatest force is actually experienced in the pre-retinal layer compared to the subretinal layer. And now this is statistically significant. And that probably explains the greater number of pre-retinal and intraretinal hemorrhages. And you rarely ever see actually subretinal hemorrhages in normal vaginal delivery. So how can artificial intelligence help us with this information even further? What can we do to go even further? So we're using an AI deep learning model where data is filtered through a cascade of multiple algorithms layers, with each layers using an output from the previous ones to improve the accuracy of the new results. So what this means is that as the AI becomes more and more accurate and precise as they process more accurate, this is the important part, more accurate data. So what this means is so if you could just imagine, you have a group of residents or fellows looking at various patterns of strabismus, as we have just talked about INO. So looking at these patterns, and as they process and try to remember these recognize these patterns, initially they may get these diagnoses wrong, but as they repeat these process multiple times, we're talking 1,000, 10,000, 100 times, 100,000 times, this is going to become better and better and better, and they're going to come up with a better outcome. So what we are doing at this point is that we are collecting images all over the world, and we're putting the accurate information. For example, shaken baby syndrome that is court case confirmed. Also, soccer ball injuries that actually had been well documented with the previous records, and also the normal vaginal delivery with the babies that are with the pictures taken right at birth. So we're feeding these informations into the AI along with other types of retinal hemorrhages that actually may occur from anemia, hypoxia, sickle cell. And then we're asking the AI to interpret those images by counting the retinal hemorrhages along with the percentage of the retina and what percentage of the retina is covered by retinal hemorrhage. And also it can measure the size of the retinal hemorrhages in a split of a second. And then also it will recognize the locations and the patterns and identify the retinal schisis, retinal folds, and hard exudates. Not just that, it can also help us to identify the pre-retinal, intraretinal, and subretinal hemorrhages. And of course, it would also include cottonwool spots and discodemas that may be a result of a papilledema with increase in intracranial pressure. And as of right now, we have experts around the world that actually will help us with the quality control so that we can be sure to supply the most accurate information, and we continue to monitor for quality control so that we can actually have the best outcome, if you will. So when we have the outcome, the output, it will give us a number. So in terms of what is the probability of these particular photo being induced by a medical condition, or what is the probability of this retinal hemorrhage resulting from a trauma. And if it's from a retinal hemorrhage from a medical condition, it can actually help us to identify the cause, like what actually caused these retinal hemorrhages. And if it's from the trauma, it can be graded from 1 through 9, and based on those criteria that we just talked about. So in summary, so AI results it will be supplemented to the medical, family, and social history, and the clinical findings and physical exam, and the blood and MRI findings, as well as, and it's going to supplement the input from various specialists to help us determine the truth, and hopefully that will help to save our children. Thank you. Any questions?